So my name is Amaroa Katu. My role is the Community Health Services Manager for Marlborough Primary Health. A few years ago there were some gaps with our Pacific community, and as a Marlborough Primary Health we actually didn't have anyone positioned here for that. So we took on the challenge and hired somebody, and as part of that they developed a health needs analysis and got actual feedback from the Pacific communities that were here. They built up a relationship with the leaders, the ministers, and who else was here that were coming in. And from that we employed a Pacific health worker, and that role was to go out and be the face of the Pacific. So we had one that developed our programs, and we had one that actually led and delivered our programs. We also found that because we didn't know who was here, it was actually quite hard to find out who was and wasn't enrolled in a general practice. So as part of that we developed Vege-cation. It was more about getting a foot in the door, meeting people, building up a relationship, giving them something in return, and then from there building other projects on from it. So Vege-cation itself was going to a Pacific person's house, meeting them, meeting their family, giving them the vegetables, teaching them how to use their gardens, because most of them knew that anyway and they had great gardens. And then we'd take a list of who was here, how many lived in the house, how old they were. If they didn't have a doctor, that was the avenue to get them into a doctor. If they were overdue for any of their screenings like smears, we'd run a separate clinic, and then we'd just keep touching base with them monthly or weekly. We were giving them avenues to improve their health, save money through fun budgeting because they had their own gardens. They met other Pacific people because they were sharing the foods. We met the ministers and churches, which enabled us to work with the churches to run more clinics. We were very lucky that this one actually worked out really well and that we've been able to get continued funding for it to progress.